Hello again. My name is Jennifer Wallace, and I am physical therapist and owner at Duchenne Therapy Network. This is the next video in our series brought to you by CureDuchenne Cares, a partnership with CureDuchenne and Duchenne Therapy Network. This edition is going to show the AlterG anti-gravity treadmill and how it is used with Duchenne muscular dystrophy. The AlterG is able to help with ambulation when there is weakness, injury, or difficulty with walking for many reasons. There are a couple scenarios where it is beneficial to be used with Duchenne, and we'll talk about those, but first let me explain the AlterG. First, the user puts on a pair of special neoprene shorts, steps, or is lifted into the open area of the chamber while it is in the lowered position. The chamber is then lifted up to an appropriate height, and the shorts are attached to the chamber to form an air seal. The AlterG partial weight bearing works by filling the large capsule with air, which can be adjusted from 20 to 100% weight bearing. There are three common scenarios for using the AlterG with someone who has Duchenne. Someone who is ambulatory but has recently suffered a lower extremity fracture and has no other more reasonable means to maintain some activity during the rest period during casting, recovery from surgery, or has strict weight-bearing restrictions can use the AlterG to keep moving while recovering and do so within the restrictions for weight-bearing. Someone who is ambulatory but having greater difficulty walking enough to get an appropriate amount of activity, or if walking has become too unsafe, can use the AlterG to do an appropriate amount of exercise without placing themselves at risk for injury. Someone who has recently lost their ability to walk independently may use the AlterG to get exercise in an upright position and to prevent some disuse muscle atrophy. Some of the benefits to using the AlterG are that weight bearing can be adjusted through a large range to satisfy almost everyone's needs. It can be operated by the individual with the assistance of one other person and doesn't need to be a physical therapist. The treadmill can be set as low as 0.1 miles per hour. The AlterG can come equipped with up to 2 monitors for the user to be able to see how they're doing and make adjustments from 3 different camera angles. The AlterG can be equipped with an electric lift system to assist those who are not able to step into the device. Walking on the AlterG is well tolerated as a means of light, low-load, periodic exercise. Some of the minor issues that we've encountered is that the harness for the lift system can ride up a bit if not positioned well. It is expensive and patients have difficulty finding one in their area, especially one with a lift system, and it has difficulty calibrating individuals who are severely weak. If you were thinking about trying out an AlterG, my recommendation would be to go to the website www.alterg.com and search your area for a location by you. Call those facilities and ask if they allow for trial use of the AlterG and what the costs would be associated with that. Also ask if they have a lift if you're going to be needing one. Lastly, ask them if they are familiar with Duchenne to feel out if they are knowledgeable about the risk of muscle damage with overexertion. If not, feel free to send them my information and ask them to contact me. A couple minutes of my time on the phone with them is definitely worth making sure that you or your son get the proper program started. Thank you for watching. We at CureDuchenne Cares hope you find this information useful. Please subscribe for automatic notifications when future videos are released.